can do this. You want to pop Hello, everybody. Hello. Okay, so hi. My name is Ruth. I know some of you have not met me. I work in the ED here, and I'm very proud to work in the ED here. Thank you. I know I'm not a public speaker, but I am a role model and a leader for this hospital and this emergency department, and we all need to stand together in order to make this happen. We need this to happen. It's great to see so many of my union members here. We are united and we are stronger than ever, and we are ready to stand up for our patients and our community.
Right. Yes.
We also appreciate the support here today from West Penn, Allegheny General, and our other union members. Yes. We all know this is not just about our community hospitals like Allegheny Valley. We're holding this vigil today because hospital workers across this region have been let down by healthcare systems that put profits over people.
Yes. Shame.
This is why we have voted overwhelmingly last week to authorize our negotiating committee to send a strike notice if necessary, and we stand today more united than ever, as you can see. After all, we're not alone. West Penn Union nurses held their own vote, and now, for the first time ever, union members at 2 AHN facilities have simultaneously authorized strikes. By standing together as union members across 2 hospitals, we are stronger. And we know that by standing across AHN, UPMC, and all over the region, we can transform the whole industry.
Yes.
We're at a turning point for healthcare in this region. We brought our community through COVID. We were asked to risk our own safety over and over as that of our families. What is happening to our healthcare heroes? This is unacceptable.
Yes.
We stand today at this vigil on the shoulders of union members that build up this region, and it's our turn now. We're united, and we will not allow our patients or our communities to be left behind. We know what the last few years have been like. Experienced hospital workers leaving to escape burnout, moral injury, unsafe staffing, and pay that lags behind other professions and other nurses in the tri-state area. A constant revolving door of new staff, higher patient acuity, more and more responsibilities on those of us who remain. Fewer healthcare services provided locally in our community. Many of us have not had the time nor the resources to deliver the care to the best of our ability. Staff is undervalued and unappreciated. Big health systems sidelining community hospitals, and many of us struggling to make ends meet between food, gas, and our mortgages. But we've also seen working people across the region stand up and say, enough is enough.
Yep.
Enough is enough.
Right.
We are here to stop the bleeding, and we won't back down. We will not allow big healthcare systems like AHN or UPMC to hold us back. We are prepared to do what it takes to stand up for our patients and our community. That's right. We are united for our patients, and we are determined to win the resources we need for our families, our patients, and our communities. What AHN proposed does not go far enough to invest in our staff and protect our patients. AHN must make major investments across the entire workforce, just like they did at AGH. We don't want to strike. We want to continue caring for our patients, but what we will do is to do what it takes to stand up for our patients, our hospital, and our community. Now I'd like to welcome Community Controller Corey O'Connor. Corey. Okay.
Thank you very much, and thank you all for being here. It's always hard to follow a staffer who's out there fighting for our patients and lives each and every day, but I'm proud to represent Allegheny County and to be standing here with you all today. Yes. If you don't know, Pennsylvania is in one of the most severe shortages of nurses. We are 20,000 people short. Think about that. That puts so much stress on these individuals behind us, but it also risks lives of individuals that go into a hospital. That is unacceptable for everybody in our region. To top that off, Pennsylvania and this region, we are almost 12% less in pay than these nurses earn than anywhere else in this region and in this country. That is shameful, downright shameful, because see those names on this hospital? They are making billions of dollars off of the backs of these individuals, and they wouldn't exist without their hard work. And that's why we're here standing with you to fight for this cause. And I just want to say, lastly, that, you know, I'm proud to stand here. I know Senator Williams is, and there's a number of us across this county that are standing with you. But you taking the brave steps by doing this is going to make an impact. I know you might not see it today or tomorrow, but it is going to impact thousands of lives. By you, 1,100, if this goes through 1,100 people, staff, are willing to stand up and fight for what's right, is going to make a difference in our region, because when we all fight, we all win. And that's what we're doing here today. So I'm proud to represent this county, proud to be with you, and thank you very much for everybody for attending this event.
Next, I would like to invite West Penn nurse Maggie Brown to share her support. West Penn has been standing strong with us, and we are very glad to have her here.
Hi everyone, I'm Maggie Brown and I've been a West Penn nurse for nearly 3 years. I'm so proud to be here with you all, standing shoulder to shoulder with my fellow union members on the other side of the county. At West Penn, we have your backs.
Yes.
Woo! Woo! 2 weeks ago, we overwhelmingly authorized our negotiating committee to send a strike notice, and we feel so much stronger knowing that we're not doing that alone, but with Allegheny Valley union members. We've seen what happens when community hospitals aren't invested in. At West Penn, we receive patients from all over the region, including from ABH, so we know you all are asked to treat and stabilize the same patients as us, often with fewer resources. Hospital workers everywhere face short staffing and a lack of resources, but in this region, we feel it acutely. Every day, we see experienced nurses, patient care techs, phlebotomists, dietary staff, housekeepers, and other hospital workers who are essential to the patient experience leave because we aren't afforded the same respect, safety, and compensation as other professions. AHN and UPMC tell us they simply don't have the resources for safe staffing or for wages that would keep us from living paycheck to paycheck. Do we really believe that?
No.
I got into healthcare because I care about people and I want to care for people. But I feel there's an expectation that because we all care about our patients, we will accept conditions for ourselves and our patients that other professionals would simply refuse. The truth is, because we care, we know there comes a time when we have to stand up for our patients. I'm proud of what union members at my hospital were able to accomplish in their first contract, a commitment to A1 maternal child health staffing standards. But we have to go further. We need safe staffing on all our units and a serious investment in staff recruitment and retention. I don't know about you, but I'm tired of hospital workers struggling to afford groceries, rent, and gas. I'm tired of being unable to put money away for our retirement, for our education, and for our children's futures. I'm tired of seeing people leave healthcare because they're not able to give the kind of care that patients deserve. I'm tired of hospital executives that are so removed from patient care that they don't see this system collapses without us, the frontline staff. Amen. We are here today to remind them. West Penn nurses will stand with you if you decide to strike for your patients. Together, we are stronger and we have the power to transform healthcare in this region. Thank you.
Thank you, Maggie. Next up is Senator Lindsey Williams. Thank you for joining us, Lindsey.
Yay, Senator Williams.
I'm short, but I don't want to knock things over. All right. Hi, everyone. I'm State Senator Lindsey Williams. I'm proud to represent this district. My office is just a few blocks up the street, and we're here tonight to support and lift up our nurses and hospital workers. Our hospital workers here at Allegheny Valley Hospital, our nurses at West Penn, and all of our healthcare workers across the region. I'm a patient at AHN. I'm sure many of you are.
Yes.
And if you're not, I'm sure you have a family member or a friend who is a patient at AHN. And I think you'd be hard pressed to find anybody in Western Pennsylvania who isn't deeply impacted by the healthcare system here in the region. As someone who was elected to represent this area, I want to make sure that every patient that walks through that door gets the best care possible. So if I'm talking about patients, why am I standing here with nurses and healthcare workers? It's because their working conditions are our patients' care conditions.
Right.
Say that again. Their working conditions are our patients'
That's right.
care conditions.
Right.
If we don't treat our staff well, they get burnt out. If we have double shift upon double shift because we're short staffed, if our nurses are caring for double the amount of beds that they're supposed to, they get burnt out. And when they leave the healthcare field, they're not there to train the new staff that's coming along who needs their support and guidance. Experience matters. And our patients see that every day. I'm incredibly proud to stand here and every day with our healthcare workers. These union members fought hard to form their union. And now they're fighting hard for their contract, to be treated with dignity and respect so they can continue to treat the patients they care for every day with that same dignity and respect. And their fight is our fight. So we are going to be here with them as they're standing up for their contract. We know they've authorized a strike. We hope it doesn't get to that. We hope that all of you showing up today shows those hospital executives that they have the community on their side. And so we are going to be with them as they fight for a fair contract every step of the way. And if you have to walk out, I'll be there with you. So keep up the good fight.
Senator Lindsay, thank you so much for your comments. Last up, I would like to welcome my coworker, Kathy. Kathy, please.
Okay. Hi, everyone. My name is Kathy Olszewski, and I've worked at Allegheny Valley for 35 years. I love our hospital. When it started, Allegheny Valley at its core was a family-oriented community hospital. I still love it, but there's no question a whole lot has changed. Short staffing is a challenge all across our region, and COVID only made it worse. Experienced caregivers have left healthcare in droves. I've worked in so many parts of this hospital. It breaks my heart to see us so short-staffed that new people are constantly training new people just to up and leave. And at the same time, big healthcare systems like AHN and UPMC are more focused on numbers than on people. Our patients are not insurance payments. They aren't statistics, and they certainly are not the damn survey scores.
That's it.
They're not cost centers. They are people that deserve our time, our attention, and our care. That's why I'm so glad to be with you all out here today. When I look out at you, I see people who care about this hospital and this community. And this is my community. I was born and raised here. And I lost my page. I see people determined to turn a corner in healthcare and make patients the top priority. We are united at Allegheny Valley, whether it's housekeepers or aides or dietary or nurses. We are stronger than ever, and we are resolved to win a contract that invests in retention, recruitment, and safe staffing. We have the power to change healthcare in this region. We have the power. Because without us, there's not a dollar made by any of these healthcare systems.
That's right.
We have power because we are united united across hospitals and standing up for our patients. Allegheny General Union members set a new standard. Now it's time for us to make it an industry standard across AHN. After all, they say we are a system. We're tired of seeing coworkers leave healthcare for jobs that pay better and are a whole lot less stressful. Right now, healthcare workers in this community rely on the local food banks to feed their families. Think about that. Think about that. How sad is that? But it is the truth. Healthcare workers shouldn't have to worry about how we're paying our bills and having to rely on public services and assistance just to get by. Investing in us means investing in patient care, and it means investing in our families and communities, this community. Big health systems are instead investing in expansion and growth and prioritizing the bottom line above all else. Just last week, AHN reported its financial success. Incomes are up, revenue is up, and costs are controlled. Their words, not mine. We all want the hospital to do well, but those of us on the front line know that patients must be the #1 priority. That's why we are out here today. We don't want to strike, but we will do whatever it takes to win the resources that we need for our patients and our community. I'm so proud of what we've done so far, and I so appreciate all the support that we've gotten from elected officials, other unions, and community members. I'm so ready to stand with you all and win. Let's all do this together.
Thank you, Kathy. That was wonderful. I'd like to take a moment to recognize our elected officials here today. Senator Lindsey William, County Controller Corey O'Connor, fellow union members from USW 1196. Now we're going to come on behind me here, turn on your candles, and take a picture, and then we will have a moment of silence. Before we do that, we also have 68 vacant positions. We have a dedicated staff of hospital workers that aren't always able to give patients the time and attention they deserve. We have a healthcare system that puts profit over people. Please, everyone, grab a candle, turn it on, and proceed behind me and face Freeport Road for a photo. We will then turn and face the hospital and have a moment of silence. Thank you.
Come on over, everyone. Come over this way.